direction on this. Unfortunately, the centre is buying into this whole idea of localisation of decision making. Well, I mean, as we've seen this evening, the problem is that commissioning groups straddle different areas and they've got differing sort of competing sort of needs. So therefore, you're never going to, I mean, there's a commissioning group here, a couple here, I mean, you know, there's more than one commissioning group in this, on this and that. There's a federation in, I don't know if it's, what was it already? A lot of this, to a certain extent, is to do with personalities of GPs, because I've worked all over this place, so trust me, I know which ones are more troublesome. And I think the problem is that you do need central direction on this. And that's my responsibility. I don't have the facilities or indeed the sort of bandwidth in my office now to run a grassroots campaign. We just can't do it. I mean, I wish we could, but we're just not in a position to do it. What I need by doing this going around is that hopefully people will pick up the baton and Wycombe and Marlow and Slough and Windsor and Burnham and Bracken and Ascot, wherever it is, and they all get together and start talking to each other. You know, I'm happy to be the sort of, oh, speak to so-and-so, speak to so-and-so, speak to so-and-so. My responsibility is sort of to firing at the DOH, which I do. I mean, I do go in and see them.
But sorry, what can we do to help that? Do we write to our MPs? You can write to your MPs, you can just create noise, you can write to whoever you want to write to, and you make sure you spread it to everybody else. So it becomes, I mean, I think Terry's a family you've got a few thousand people on your list. I mean, if that was to be replicated across a region, it would be remarkable how much pressure that would be applied to it. Also, it also gets people understanding the issues, because as the lady quite rightly said, it's quite difficult to get this over in a way, in some ways, because it's quite a complex issue and it's an emotive subject, and people feel vulnerable if they're sick themselves or if their family is sick. And I understand that, and to a certain extent, it's not about just disseminating campaign messages, it's also disseminating understanding. Because the broader point, and I should bring comments to a close now, is that, you know, I strongly believe this is going to happen, okay, up and down the country. And the only way it's going to happen politically is if people understand the issues and understand why it's happening. But it's not just cuts and what have you. It's actually to do with trying to structure our health service for the 21st century. Approaching 25% of our population are over 60 now. We enter that period with such an ageing society with over £1 trillion worth of debt and approaching £2 trillion of liabilities on public sector pensions alone that we can't meet. I think we all need to wake up and smoke a coffee a bit and recognise that what we've got isn't going to work in the way that we want it to work in the medium to longer term, and that we need to be perhaps braver and perhaps a bit more courageous about trying to bring forward a structure, a system that will work, that will look after our elderly today and our elderly of tomorrow. And I'm just playing my own little small part in this region because I was born around here in a hospital that no longer exists. And I have family and friends and a lot of sort of connections with this area, deep connections with this area. And I want to see the very best outcome for this area and everybody lives in it. And I just think that something like this, location is negotiable, something like this is in all of our best interests. Thank you very much.
Taxpayers' right, though, to have somebody to senior level in the Department of Health, you know, putting all this on the internet, stats on there so people can sit down, interact with it, understand it.
Yeah, I mean, it's
disgusting in this day and age.
It does intrigue me. You make a fair point. It does intrigue me that King's Fund, the Royal College of Surgeons, the Royal College of Physicians, the Royal College of Paediatricians, I'm sure the obstetricians as well, because it was an obstetrician who led the consolidation of services in Northumberland. All of these people singing from the same hymn tune, all coming to the same conclusions, all realising what's needed. And yet, I can't find a civil servant who's working on this.
I think that people just...
And if you think about how many people are employed in the National Health Service, 1.3, 1.4 million people, and yet, I mean, what was the Strategic Health Authority doing?
I
think this is strategy.
And I know what I'm talking about. And, you know, it's just absolutely disgraceful. And just as a you know, regardless of your politics or your views or whatever, you have a right to this information. You have a right to it on the internet, and you have a right to be able to click around.
Yeah, and I think can I suggest you write to your MP? We have two in this room.
Don't worry, I won't be my MP will be writing to. It'll be bloody David Cameron, believe me. I mean, honestly, it's
all right. Well, look, you make a fair point. As I said, I will go back to your point. I will persist at sort of lobbying at the centre. And if you want sort of contact details of people who may want to help or whatever, by all means contact my office. But I must stress I'm not in a position to sort of run a sort of full grassroots campaign on behalf of many people. We just don't have the resources.
Can I wrap this up? I think Dr. Gamble, can you leave a very quick point?
Yeah, just two quick points. One is that the CCGs in Berkshire and the CCGs in Buckinghamshire are talking to each other and working very closely together. And there's a Thames Valley area which includes Oxfordshire as well. So they are talking. Things are not happening in isolation. And just for us, the vascular services that are moving are the acute emergency aortic aneurysms. The other vascular work is remaining in Wycombe and will be consulted on again in 2014, as was concluded in the consultation.
Thank you. All right, I'm going to wrap up very quickly. I want to thank everybody for coming here tonight. I want to thank Dr. Lee, because whatever you may think of him is very brave. But just for 10 seconds, my take on this is that we have doctors in the room, we have politicians in the room, we have health bureaucrats, and they are all singing from the same hymn sheet, which is the District General Hospital, the model is dead. There's lots of country bumpkins, me included, who remain to be convinced, and until you convince us all, it's probably not going to be easy for you. So anyway, I want to thank you very much for tonight, and Mr. Baker wants to say goodbye.
All right, if I can, I'll just make a couple of quick points. Madam, you're absolutely right about information. You should have all the information.
Right. This is the human right. It could be taken to court. Because eventually...
Hang on, can we have that conversation afterwards, because I'm sure everybody wants to go. I just reviewed our colleague Douglas Carswell's book, The End of Politics and the Beginning of Our Democracy. It's really interesting. It makes all the points you've been making. I hope you'll write to me, though, because if you write to me, you'll get my answer. If you write to David Cameron, you'll get the correspondence unit. We'll just give you the standard policy. But 3 points, the 3 problems that against this proposal. 1, it's not what the public want, for all the reasons that Steve's just said. 2, it's not what the clinical commissioning group wants. And 3, we haven't got the money. And I know you've touched on all of those areas, but for those reasons, it's extremely difficult for me to support it. If the public weighed in with a big grassroots campaign, it's what everybody in Wycombe wanted, for our hospital to lose all its acute services and centralise them down at the junction, then of course I'd respect democracy and get behind the public, and I'd try and change the clinical commissioning group. If the clinical commissioning group were jumping up and down and saying they wanted it, then perhaps I'd rise to the challenge of providing some leadership and try and persuade the public. But all the time, neither the public nor the CCG really want it. It's extremely difficult for me to get behind it. So I'm Philip, I'm going to have to say it's extremely interesting, and I really, above all, respect your passion. I got into politics because I was fed up with it and thought it needed doing properly. And one of the things I'm proudest of is that I have actually got some colleagues who are prepared to be as courageous and honest as Philip is. And believe me, as a politician, he really is being extremely courageous because he wants to shut his own hospital. So, Philip, thank you very much for all you've done and for coming. And I'm sorry we didn't turn out more people for you, but thanks very much.